Hello, everyone. Good morning, good afternoon, good evening. We're so excited you're joining us today for our last and final session of the Africa Climate and Health Responder course, Climate and Health Research and Funding in Africa. We have an incredible panel prepared for you today. Before we get started, I'm going to go through a couple of housekeeping items. First of all, we do have simultaneous translation available in English, French, and Portuguese. You can find the interpretation button on that little globe at the bottom of your Zoom toolbar. Another housekeeping announcement, we are awarding a certificate of participation for this course. Those of you who attend at least 8 or more of the live Zoom sessions and pass the final exam at the end of the course will get this certificate in participation. Of note, your attendance will be automatically recorded with the email you use to join this Zoom and the email which you registered with. Please make sure you always join with your same registration email link. As this is our last session, I want to give a little bit more information about the final exam. Important note is that when you are going to take the exam, you'll be asked to enter your email address. Please make sure you use the same email address that you used to register for the course. The exam will be open later this evening, and it will close this Sunday, October 27th, at the end of the day. We will be sending an email after the close of this session with instructions for where you can access the link to the exam. There will be 25 multiple choice and true-false questions, and you will be required to take the exam in one setting or one sitting whenever you find that time to be convenient. I'm really delighted to announce that we are going to be having a second initiative following this course. As you know, this course has covered many emerging topics in the health impacts of climate change in Africa, and we've all taken major steps to ensure that the continent is more ready to respond through the education we've received in this course. But we know that more work is needed. And so our larger working group is delighted to announce that we will be launching an educator training program in climate and health. And this is really going to be the first of its kind in the world. The goal of this initiative is going to be to equip educators in Africa to deliver climate and health responder courses in their own institutions or in their own communities to a broad range of potential students. We aim to engage with roughly 50 participants for this course, which will really be a community of practice that's going to be supported by the expert faculty who ran the Africa Climate and Health Responder course, as well as many others. This will be a 15-session course, which will start in February of 2025. The important thing to know is that this course is open by application only and spots are limited. In order to be eligible for this course, you must be an educator or be in an education role in your organization or institution, and you must have completed and received a certificate of participation in the Africa Climate and Health Responder course. So we will be sending more information about this, so be sure to check your email, and we look forward to seeing you in February. Now, without further ado, I'm delighted to kick off our last session today on climate and health research and funding in Africa. We have some learning objectives here, which you will see on the slide, but you can also find on the website. And with that, I will turn it over to our moderator for today, who is Dr. Charles Michael, who is from the Africa CDC, where he is a senior technical expert and the climate change and health lead. Over to you, Dr. Charles.
Thank you so much, Cecilia. And again, colleagues, you're welcome to the last session. I would say that it's a hooray for all of us that have made it through all of these sessions. And today we have a very unique session where we're having very erudite and well-known stakeholders on climate change. Yeah, so we have very erudite scholars and non-stakeholders on climate change and health financing. You all agree with me that over the last few weeks, through the 10 sections we've already held, we've seen the need for us to be able to intervene collectively on climate change and health. But then we need to also understand, how do we assess finance to be able to drive this, all of what we want to do? So with me today are three panelists. The first person is Madeleine Thomson. He's head of impacts and adaptation with the Wellcome Trust, with expertise in global health, climate adaptation, and climate-sensitive health interventions. You're welcome, Madeleine. We also have Samuel Oti. Samuel is a senior program specialist with the Canada International Development Research Center, IDRC. He's on research funding, health system strengthening, policy, and digital health innovations in Africa. And lastly is Matthew Chersich, who is a research professor with the University of Witwatersrand. He's leading expert on climate change, heat impacts, and adaptation strategies in African population. Today, we're going to have these three panelists answer sets of questions that speaks to how we can strengthen financing for climate health research. And we'll also take questions from you, our esteemed participants. So please ensure that you enter your questions in the Q&A section, and that those will be harvested and turned over to our panelists. So again, to the panelists, you're welcome. And you know, climate change and health is very dynamic, especially in the African context. And many of us have been looking, what are local financing mechanisms or instruments that exist for climate and health research in Africa? And how can local researchers assess them? We want to really know this because we have among our participants some local researchers. So I want to start with you, Madeleine. What is your view with respect to local financing mechanisms and instruments that exist for Africans and African researchers? Over to you.
Thank you so much. And I'm absolutely delighted to be part of this panel. It's a really exciting opportunity to engage with a very broad community in Africa. So I'm at the Wellcome Trust, which is a philanthropic organization based in the UK, but with a global remit. And we have a climate and health program specifically to support researchers globally on climate and health. We have a very substantial endowment. We're one of the largest philanthropic organizations in the world. Philanthropy is one way to access finance for climate and health research, because philanthropy is really about catalyzing innovation, doing the work that is hard to do from government, from the private sector, which is to take risks, to invest early, to work on new areas that really don't have confidence yet.
I will come
later. So in the African context, we see that there is still a lack of funding in this space, but the situation is changing. Substantial investments now that are coming from the Global Fund, from the World Bank, etc., for health are starting to include climate. And that means climate research is going to be more and more relevant to the direct functioning of health systems on the continent. But there are many different aspects of climate change and health that need research. And so there is philanthropy, there is the bilateral funding that comes from governments outside of Africa. There is African government funding as well that is starting to emerge. And there is some funding from the private sector. So there's a range of opportunities, but this is an area that is growing substantially. And I think in the next 3 years, you'll see it's actually a very different landscape from what it is today.
Thank you so much, Madeleine. Thank you for listing those out, and they're very clear. Colleagues, I hope we're taking notes. Samuel, I'll turn it over to you. Are there additional inputs to these areas of funding for African research that you want to avail participants of?
Yes, thank you very much, Charles. My name is Sam Oti, Senior Program Specialist with IDRC. We are a Canadian funding agency set up by an Act of Parliament in Canada about 50 years ago. And we fund research in the Global South on a variety of development issues, including climate change and global health. Now, I'll speak more about our programming a little later on. But just in addition to what Madeleine said, I think there's tremendous opportunity for the health sector to leverage funding from the climate sector. So we have large multilateral funds, things like the Green Climate Fund, the Adaptation Fund, more recently the Loss and Damage Fund that's coming up. These funds are out there. They are potentially available. But up until now, for example, I think it's only around 0.5% of adaptation funding that's coming to the health sector. So there is a huge potential, there's a huge gap, which I think the health sector has not yet fully leveraged. Now, having said that, I think we need to focus on how to strengthen the capacity of the health sector to access some of these instruments and some of these facilities, because they can be quite bureaucratic. And anecdotally, for example, I was speaking to someone from a major European funding agency, and they had been initially accredited to have access to the Green Climate Fund, but they lost their accreditation and they didn't bother to renew it because it was just simply too bureaucratic and too complicated. Now imagine a Ministry of Health in the Global South. It must be much more daunting for them to be able to access funding from the Green Climate Fund, for example. So how do we work to strengthen the capacities of institutions in the Global South, whether it's government, whether it's academic, whether it's research, to be able to access this really multi-billion-dollar funds that are out there? That yes, they're primarily focused on climate, but because we all agree and we all know the impacts that climate has on health, we need to increasingly begin to access some of those funds. Back to you, Charles.
Thank you so much, Sam. Yeah, thank you so much. I think those are well taken. And I think that is why this course was initiated by this consortium and the team, because we know that we need the prerequisite capacity to be able to access some of these funds. But I think as you highlight them and we take note, we can now begin to tailor down our capacity building to target some of this funding opportunity. And that brings me back to you, Matthew. You've been a researcher for a very long time.
Charles, I don't know if it's a line on my side, but your sound dropped. Is it just me?
Sorry, can you hear me?
Yeah, that's better. Good, so it's not me.
Okay.
Or both.
Yeah, no, it's not you. Yeah, you've been a veteran researcher. So based on your research experience, what are the most pressing climate and health challenges facing African populations today?
Okay, thanks, Charles. So, I mean, this is quite a difficult question. And I thought, when I was thinking about it, I thought maybe let's take a step back and try and contextualize some of the experiences with climate change in Africa, and also where the kind of continent is at the moment. So, there's always 6 or 7 features that I think we should highlight. It's the continent that's least responsible for the crisis, that is most vulnerable or most affected by it. We have the least resources amongst ourselves. And we're accessing, like Sam said, we're accessing very little, and almost, in the health sector, certainly, very few resources to assist countries to respond. We also have very low representation in many of the global structures. So we have some of the least representation in many of these international structures, and we also know very little about how to proceed or what is needed. So you asked me what are the biggest challenges. I thought, okay, let me start by saying that there's a large number of challenges, but equally there's a growing number of opportunities. And I think on each of those challenges there is a response and a coherent movement forward. And so, it's a course like this, I think, shows the interest and the systems are getting in place for us to meet some of these challenges. I think maybe just to highlight, I wanted to highlight 2 of these challenges in the larger picture of Africa and the challenges. You wanted a broad answer. So I think the largest challenge is that as a health sector, we're not involved in prevention sufficiently. So we're not involved enough as the health sector in trying to prevent further worsening of the climate crisis, because we were going to be the most affected. So we require prevention at the highest international level. If Africa, other countries may well air conditionize themselves at least partly out of this crisis, but we are really in desperate situations. Our needs for prevention are even greater than others. And when we say prevention here, we're talking about public health steps that we know how to do. We need to use public health strategies to control emissions from fossil fuels, drawing on all the skills and weapons that we know in public health. So that's a large research area that I think hasn't really been tackled. And then it's other basic public health stuff, Charles, is we need to have a surveillance system in place that allows us to measure, monitor costs, and advance our deep understanding and have road signs or different directions, so we're clear which way we need to go. Yeah, Charles, I covered a lot of ground there. Do you want to come back?
No, yeah, thank you very much there. I think you've covered a lot of ground. One thing that come out clearly is that you did allude to the fact that Africa has myriads of challenges related to climate change and health, but you are really advocating that a lot of the challenges around prevention should be prioritized. And you also talked about strengthening our surveillance system to be able to anticipate and respond adequately to some of these challenges. I think those are clear, and we've taken note of that. So I come back to you, Madeleine, and I would want to know from you, Wellcome Trust has been at the forefront of addressing health challenges linked to climate change. How does the organization prioritize funding for climate and health research in Africa?
So our strategy is very much about supporting science to solve the urgent health challenges facing everyone. And when we say that, we basically fundamentally mean that if it's everyone, it has to be an equitable process. And if it's going to be equitable, we need to focus on the most vulnerable populations, those who have most exposure to climate and health-related impacts. And so Africa is, we've just described, really absolutely fits into that category. How our funding goes there, we fund in 3 different ways. We fund through open calls, or sometimes there's limited calls, which is where we invite people to put their best ideas forward. It goes through a selection process, and we have external committees and reviewers, and they decide who should get that funding. We have had limited calls that are limited to principal investigators from low and middle income countries. And so through that mechanism, we have quite a number of African principal investigators. We have calls that are limited to high income countries for some of the mitigation work. We had one call limited to G7 countries. We are actually putting forward a call on mitigation and health co-benefits for low and middle income countries. So that's something to think about, and that would address specifically this prevention work in Africa. So we have different mechanisms. Also, we develop discretionary awards. Sometimes we decide that in order for us to achieve our mission, we need to invest in a certain area. And you may have heard from the World Health Summit, we had a substantial investment in WHO to enable them to put climate right across their whole program of work in the new GW 14. So that would become as a discretionary award because nobody else has the role of WHO in the world. They are specific to their global mandate. We also do contracts where we really want to understand a new area. And for instance, we supported a program called Connecting Climate Minds, which was about enabling us to understand what is the interface between climate change and mental health. And that was run as a global dialogue, which included a lot of discussion in Africa with the African community. And in that sense, it's a contract to Wellcome because we are asking a very specific question. So there are different mechanisms for funding, some of them targeted to particular principal investigators, others targeted to specific outcomes. we have new specific activities for funding in Africa. My colleague Madeleine is developing the concept of science to policy hubs, which we will initiate in Africa. And there's discussion going on at the moment as to exactly how those would be developed and the process for not only for applying to be a hub in the region that would enable the research community to engage specifically with the policy community. So we have a range of mechanisms. One of the challenges that I think with Wellcome funding is that quite often it's quite large funding. For instance, in our climate impact awards, we're looking at 2 to 3 million pounds, and that for some groups is a large bar if they haven't previously accessed smaller research funding to enable them to build up their research portfolio. So then also we work with other funders, such as the Grand Challenges, to provide smaller grants to enable a wider selection of African researchers to start, if you like, their research journey.
Okay, thank you very much.
Yeah, I can just say, and also.
Okay, yeah, I think that's been quite elaborate, and I'm happy that you're bringing out to fore these opportunities, and I think that colleagues, Wellcome Trust has a lot of opportunities, like Madeleine has highlighted, with different mechanisms for fundings. And I think I want to implore all of us to go to the Wellcome Trust website and check for opportunities that are associated with our various research areas. And thank you very much. Yeah, so one last word on that.
I just wanted to say that when you go to the website, look for, you can sign up for a newsletter, which will indicate all of the research opportunities. And one of the things that I think is particularly relevant is that we're also going to invest in 1 or 2 hubs in Africa, which will help African scientists actually access our grants, because we know it's not easy to access a Wellcome grant. And so we're trying to build in the infrastructure, if you like, that will make it more accessible to African researchers.
Thank you so much, Madeleine. Thank you for those additional insights. I think that's very rich. So Samuel, I'll turn it over to you. Are there initiatives that IDRC has undertaken to build the capacity of African researchers? And how do you ensure that these efforts lead to sustained research impacts? I hope you got my question. Are there initiatives that IDRC has undertaken to build the capacity of African researchers? And how do you ensure that these efforts lead to sustained research impacts? Over to you.
Yes, that's clear, Charles. Can you hear me? I heard my mic was not very clear the first time. Is it better now?
Much better. We can hear you now.
Perfect. Thank you. So thank you, Charles. So like I said, IDRC's mandate is to fund research in the Global South and to support research capacity strengthening in the Global South, preferably led by researchers and research institutions in the Global South. Now, traditionally, you can think about how we approach capacity strengthening at 2 levels. You could think about it in terms of organizational capacity strengthening or individual. In the past, we've had significant investments in individual capacity strengthening, whether it's through studentships, scholarships. At some point, for example, we were contributors to the African Doctoral Dissertation Research Fellowship that is housed, that at the time was housed at the African Population and Health Research Center. And then these are studentships or scholarships that are provided to African scholars to enable them to advance their education and advance their scholarship. But increasingly, we are moving towards a more, I think, organizational focused research strengthening approach. And so what we do is to try to embed research capacity strengthening into the grants that we provide, rather than providing standalone fellowships or studentships. So for example, we could set up what we call research tiers. So we would have a competitive call and we'll invite applicants to submit proposals to host a research chair at an institution in the Global South on a particular thematic area. And then through that research chair, we expect that those researchers, the chairs, so to say, they would be senior researchers or academics in their field in the Global South. And we expect them to work with and mentor and support emerging and early career researchers as well. And so that has been one example. And even beyond the research chairs, whatever projects that we support, we typically encourage our grantees to include some funding, either to provide some scholarships for master's students or doctoral students, to include postdoctoral students, and to particularly pay mind to having some gender balance in the distribution of those opportunities, given the traditional barriers that women in particular have faced. Now, having said that, specific to climate change and health, now historically we funded lots of programming in climate and health separately. We've never funded them together up until now, up until the past couple of months, where we've set up this program, which we are calling Advancing Research on Climate and Health. And now this is a partnership with UK SCDO. And similar to what Madeleine mentioned about this hubs that they're trying to set up in Africa, we are also setting up 5 regional hubs for climate change and health research in the 5 regions where we work. So that would be East and Southern Africa, West and Central Africa, the Middle East and North Africa, South Asia, and Latin America and the Caribbean. And these hubs have 3 thematic focus areas. So one is on responsive health and climate data and information systems. The other is on developing a skilled, diverse, and inclusive health workforce, enhancing search capacity to respond to climate-induced health risks. And the last is on mobilization of equitable health policies and services research. And our expectation, these hubs are just about to be launched, is that once these hubs are launched, that they are going to sub-grant to researchers who are innovating at that nexus of climate change and health in their respective regions. So even though we have this 3 broad thematic areas, we expect that within each of those regions, they are going to contextualize those thematic areas to respond to the specific policy opportunities and the specific knowledge gaps in those regions, and then provide sub-grants of different sizes. So it could be small sub-grants ranging $10,000 to $20,000, $30,000, all the way to larger grants, relatively larger grants, $300,000 to $400,000 within those regions. So I'll encourage all the participants to look out in their respective regions and look on our website as well. We're going to, on our social media, we're going to announce where those hubs are going to be hosted in those 5 regions. And within the next couple of months, those hubs are going to be launching their own call for proposals. And they'll be funding, I hope, exciting work on climate change and health research.
Thank you so much, Sam. Thank you so much. Colleagues, if you're listening attentively, you will see that there are more opportunities than we're made aware of. And I think this forum provides the opportunity for us to be able to interface with these funding avenues that are actually within our domain. For some of them, I'm actually also getting to hear about them now. So let's keep discussing these issues, and let's look at these opportunities. Let's take notes. Let's go to the different sites, and I think we can also interface afterwards with our panelists. I'm going to turn it over to Matthew now, and I think this brings out some of the issues that have been highlighted by both Sam and Madeleine. We've seen several opportunities. One of the things that Madeleine did say was the fact that the Wellcome Trust grant applications require specific capacity. And that brings me to Professor Matthew. And I would want to ask, you've worked and led large-scale research projects across Africa. How important is capacity building in ensuring that local researchers can independently conduct impactful climate and health studies? And I want you to juxtapose this with what Sam had just said, that prior to now, there had not been a lot of thoughts around that nexus between climate change and health. Now that it's becoming increasingly important that these issues come to fore, how do we build capacity of researchers to be able to intervene effectively in this area? Over to you, Matthew.
Thanks, Charles and Madeleine. I think so. Yeah, maybe can I start by saying that a kind of a something you might not expect. So I actually am not so concerned about the amount of capacity in Africa for climate change and health. It's not something that worries me that much. And I'll give you an example why. The SHAC conference, which is next week in Zimbabwe, organized, and this is funded. They're funding around 60 early career researchers. I was part of the panel. There were I can't remember how many applicants, but really exceptionally high quality people were unable to get funded. Great career researchers. And they had almost 600 abstracts submitted for, this is the first Climate Change in Africa conference, almost 600 abstracts applied. And in the end, I think close to 250 talks or posters. I mean, that's for someone who's worried about doing research with the capacity to have had such a major response and at really, really incredibly high quality. And yeah, so I think that's the first point, is that I think we are really exceptionally well capacitated. In a way, we're very lucky to beginning the field of climate change and health research as the field of something like HIV research perhaps starts to diminish, as there's a whole group of exceptional researchers that were incubated over 20 or 30 years of the HIV pandemic. And that whole body, that whole core of researchers, I think are really interested in climate change and health. And they really have a really far advanced and excellent set of skills. So I think there are wonderful people out there already who will find our work, really, very interesting and really bring that capacity. There's Sam from IDRC and Madeleine that also spoke about the amount of opportunities there are. So I think there's already a whole number of opportunities for an existing, really dense set of workers. So that's maybe one other point about capacity is that the more and more we learn from AI and the more we introduce that into our work, the more that is able, if we get this right, to build that capacity and to enhance some of the missing gaps in skills. So I'm not so worried about capacity in that way. The parts that do worry me is that there are some gaps in our disciplines. And I think, Charles, the second part of your question, I think alluded to this, that there are some gaps in health researchers being a little bit wary or concerned about, can they understand climate science? There's a large gap in number of climate scientists who are able to communicate effectively with health practitioners and vice versa. So I think there are some of these niche gaps in disciplines. And I think maybe, so just to end that part that I think does worry me is that the people with capacity in Africa are often not pushed or not able themselves to stand up and put themselves at the forefront, and to take the speaker positions and to write their proposal and to be first or second author on bodies of work that they've produced. So I think that is something I think we really do all need to think about. Who is it in our organizations who can be pushed and grown, etc. And the final point is that the capacity we can grow from within, but equally some initiative like we're part of today is important. So there is a link. The global North and South relations, I think, are getting to a healthier space, where I think we are treating each other as equals. And in fact, in a lot of my work at the moment, we're doing South-North capacity building. And so a lovely relationship that we're much more equitable. And I think we're learning, and so we grow together, to build this overall body of multidisciplinary work. As translators are suffering with my speed of language.
Okay, let me interject here. I just wanted to clarify, and if I heard you correctly, one of the things you're saying is that there's capacity in Africa to a great extent from what you've seen so far. But then I wanted to talk about capacity to access available funding in terms of grant writing capacity. Right. What would be your take and contributions with respect to making African researchers more competitive in terms of assessing grants, both those that are declared competitive globally and those that are targeted specifically for Africa?
Yeah, thanks, Charles. You asked a very nuanced question there, which my response had lacked. So, yeah, I mean, maybe this is a historical problem in that a lot of the larger grants in Africa were maybe written predominantly by global North researchers, and maybe that part of the skill transfer hasn't taken place as much as analytical or field or epidemiological skills. So I think your point is a good one. And what we've been kind of thinking for quite a while at a larger global level would be having a more systematic approach to much of this work. So if there is, particularly Sam spoke about the Green Climate Fund and Adaptation Fund, the health sector lends itself towards having generic proposals or generic documents that already are on the shelf. You do need to rebrand, and you do need to do some find and replace, and you do need to locally adapt, but we are able, much more than any other sector, to have generic kind of set of chapters or modules that countries or researchers can then they can then take from. So I think it's just a carefully thought out process around how to simplify this. And maybe also, Charles, this is a larger problem with the field of research, that you might get the excellent student who will spend 6 months of their life crafting and writing something, and then it doesn't land up getting through.
Yeah.
And it may have been great work, and nothing wrong with the student, and they may end up demoralizing and return to I don't know, wherever sector they came from. So I think there is an issue around how the model works, and maybe the kind of hub model that's been spoken about is part of that solution. And I don't know, Madeleine and Sam, is that this new model, and I know NIH is also doing a kind of hub model throughout Africa. Is that new model part of the response to what, a funding structure that was challenging for some? It sounded like it.
Yeah. Thank you so much. And I think Madeleine will come in here, but I want her to tie her responses to your question, to this other question that is highlighted for her specifically. It's been mentioned that capacity building is crucial for sustainability of climate actions. And we are really talking about capacity building beyond the technical know-how. How do we also empower these people with very good epidemiological and science technical capacity to become more competitive in grant writing? So, Madeleine, I would like to get clearly from you for our participants, how does Wellcome Trust support African researchers in developing the skills and knowledge needed to lead climate and health research, as well as access funding?
Madeleine, you
Madeleine,
unmute still.
Yeah.
Sorry.
Apologies.
Sorry.
I was just trying to make sure you didn't hear me coughing. So when we have a cohort of grantees that respond to a call and are successful, we then can implement a cohort support mechanism, and we enjoy bringing those researchers together and learning from them what types of capacities they would like to have in addition to support their work, and then work with them collectively to bring workshops, new experiences, etc. to that cohort. So that's one type of capacity building. I think you have to recognize within the climate and health team at Wellcome, we have 3 sub-teams. I head the climate impact and adaptation team, and my colleague Modi heads the capacity and field building. And that is because we recognize that it's not even just the individuals and the institutions that need to be built, but the whole ecosystem that supports climate and health research. So that's, we have to think about what is the whole ecosystem that needs to be developed. Compare with climate and agriculture, and think about all the universities, the journals, the courses, etc. So we have a whole ecosystem to build. We have institutions to strengthen. though I think the hubs are a way to ensure the connection really between the research and the policy environment, which is quite hard to do in many university structures. And so the hubs have more flexibility in many ways, that they can be designed with more flexibility to bridge that and therefore to build capacity in that communication. And just finally, Matthew brought up the issue around building in the connection to climate. And we had at the World Health Summit, we're basically saying you can't really do climate and health without climate. It doesn't make sense. But we don't really have a strong partnership in Africa or, in fact, globally between the climate and health community. So we've just invested in the World Meteorological Organization, WHO and WMO office, to strengthen the capacity of the climate community to talk to health. So, and then we will be looking at how are the services developed by the climate community relevant to the health community. And that is another area for capacity building. It's basically those partnerships that are going to be really important. So I hope I answered your question, Phil.
Thank you very much, Madeleine. This is thank you for those insights. So I'll turn it over to you, Sam.
Yeah, did you want me to respond on the capacity issue and the
Just yes, I want you to respond, but I actually wanted to add a nuance to it. Now I'm looking at some of the critical factors that you consider in funding. Can you hear me, Sam?
Yes, I can hear you.
Yeah. So I'm just looking at what are the critical factors that your organization considers when funding research proposals related to climate change and health in Africa. So as we talk about capacity, I think it's good that participants in this forum understand some of those key elements that is actually prerequisite consideration for you when you are determining funding climate change related and health related researches. So what are some of those critical factors that you consider?
Yes, thank you very much, Charles. I think the issue of capacity is quite tricky because sometimes it's used by funders, and especially those in the global south. I don't say as an excuse, but perhaps as an excuse not to do the hard work of being intentional about working with local experts. I think sometimes it's just easier to invisibilize the capacity in the South, in the global South, and I know we want to live in a world of meritocracy, right? And that makes it a bit difficult. So what we've done in the past and what we continue to do is to be very intentional about how we recognize and source capacity from the global South. If it's a field that is relatively new and we anticipate that the capacity will be low, then we are intentional about building that field. For example, when the NCDs, non-communicable diseases, became sort of all the rave several years ago, we realized that at the time the capacity was relatively low. But there were some countries in Africa, like South Africa, where Matthew is based, that had capacity. And so what we did was to be intentional about fostering South-South collaboration, where we encourage and incentivize the universities and the academics and the research institutions that had that capacity to partner with institutions and researchers that were weaker. And that sort of paid dividends down the line, that those researchers and research institutions that the South African institutions partnered with now went on their own and became sort of stars in their respective fields. And so if you don't do that, then things you can perpetuate this cycle of just funding the usual suspects, right, and never carrying others along. And even geographically, even IDRC, when we look at our funding portfolio, it goes to the usual countries. It's Kenya, it's Ghana, it's South Africa, it's Uganda. What about Eritrea? What about South Sudan? You need to be intentional about how you support those countries and carry them along, even though they have limited capacity, and sometimes they actually do. Now, back to your question about what we look out for in research proposals. Obviously, we want the proposal to be policy relevant. More often than not, that is the big ask for us. Where is the policy opportunity? Where is that policy lever that this evidence will eventually pull and lead to some potential impact? Where is the proof of ownership? And it's going beyond just getting a letter of support, because anyone can get a letter of support. I can write to my contacts in the Ministry of Health and they'll give me a letter of support. That does not mean ownership. So how do you go above and beyond to demonstrate that you have ownership of those that will eventually use the evidence that you generate? And that might involve giving them a prominent role in your project team as a co-investigator, having a policymaker. And sometimes we've made that a requirement to have a policymaker as a co-investigator so that they are part of that process right from the beginning. Then another issue that is really important for us, gender equality and inclusion. Again, we know about the historical disadvantages that women, even young people, minoritized groups have. So how do you demonstrate within your proposal that you're sort of addressing those inequalities, whether it's in the constitution of your team, whether it's in the research questions, the instruments that you use, the analytical approaches, whether you have an intersectionality lens to your methods. All of those are very important factors. And then obviously, because our mandate is primarily the Global South, we want to see strong proof of strong Global South thought leadership within that proposal. But obviously, we also encourage North-South collaboration. So it's not to say that we don't encourage it. We do encourage it. We feel that there's a lot to be gained by joining forces together. What we don't want is for it to be parasitic or what they call parachute research, where people jump in and fly out and take all the data with them. We are definitely on the lookout for that, and we don't encourage that in any shape or form. Back to you, Charles.
Thank you so much, Sam. I think those are very clear. So if I could just highlight a few things you've said, colleagues, when you're drawing your proposal, I think it's important that you look at sustainability, and sustainability means that stakeholders have to take ownership. It means that you need to involve them from the outset, and then you also need to actually think of how these people have complete buy-in in what you're going to be selling. This is critical, as highlighted. You need to also do some gender mainstreaming, because we know that the impact of climate has some genderized disaggregation in terms of impact. And those are some of the things that Sam have highlighted. And also they have focused on the on interventions that actually look at the Global South. And I think these are key things that he has highlighted in addition to all the other things he has said. So because of time, we're just going to wrap up now, and I'm going to take us, I'll take it back to Matthew for his last comments. But basically, I want you to make your last comments related to the National Institute of Health HEAT Center, and given your extensive collaborations with international organizations like WHO, what role do you see global partnerships playing in advancing the capacity of African researchers to address climate and health challenges? I want you to answer that and wrap up your comment in your answers. Over to you, Matthew. Matthew, if you're speaking, you're muted.
Apologies. Yeah. Okay. Sorry, apologies. I think what's pleasing about this relatively new field is the for their partners to collaborate and be coherent in their work, and to work together with a kind of a clear research agenda. And I know there's been a lot of work at WHO and a lot of work by AKU, Aga Khan University, to prepare coherent research agenda. And I see what I've seen so far is the global funders really are collaborating, discussing, mutually supporting each other. And I think the coordination would be really helpful for researchers, that we can work, we know what we able, I think, as a researcher, to be able to have your own agenda that you have believed is an important one, and that is answering the questions relevant to your setting, and then you can build on that in a way that you see as coherent, that you've understood. And if you and the researchers, you and the global partners are understanding the field in the same way, it's easy for researchers to build something coherent. Once you land up with a just disjointed picture, you'll get some more shotgun approaches and a call that's unrelated to your previous work, but you try your best to fit it, and you land up with something that I think could be quite wasteful of resources. Whereas at the moment, it feels like we are moving in a coherent manner. So these partnerships I find as healthy so far. And I think Madeleine spoke about the links with WHO and how WHO, being such a key partner, hasn't yet fully fulfilled its potential and its role, and its ability to represent the globe by having people from different parts of the globe present in that department. And having kind of representation in partners is not about tokenism or about having, being able to tick a box. It's about having someone on a panel or in a department who understands, has lived in a place, who has a good, solid understanding of what's needed, which one struggles to get unless you have spent considerable amount of time in an environment. So the partnerships, I think, are healthy. They can be more representative, and there's really a positive movement in that way. And when I say more representative, I don't mean moving people aside. There's a lot of good people in all these global structures, but just make the circle a bit wider and just fill in, get more space for those in Africa to be representative and to lead, in fact, this response.
Thank you very much. If I hear you very right, I think you're actually corroborating the fact that collaboration is critical and partnership is critical. But as researchers, we need to be clear on what areas we want to collaborate, and we need to be clear and distinct with what we want to do so that it enhances our ability to collaborate and respond to calls. I think if I may summarize it, I think there is need for action-oriented partnership to be able to drive climate change and health agenda in Africa. Thank you very much for those very valid responses. And then I'll turn it back to you, Madeleine, for your last comments. And I want, as you comment, I want you to highlight what are the key areas where you believe African researchers and policymakers should focus their efforts to secure long-term funding for climate change and health research.
So thank you. So first of all, I think if you want to engage with policy, you've got to understand what are the big policies that are going to stay in Africa for the long term. So really understanding what is driving continental policy, regional policy, national policy. And that means that the work that you do going forward can be aligned with the needs of policymakers. Yeah. So if you're looking in the past, maybe there was a policy 5 years ago that looked really interesting and your research addresses it, but it's no longer where the policymakers are going. It's no longer on the active agenda. Then you're not really going to achieve very much going forward. Sometimes you have to break new ground and there are no policies, and you actually have to drive the policy agenda by identifying new opportunities. And then you really need to be convinced that there's a real gap in the policy space that your research can bring attention to. A good example of that, I think, is we made an investment on the impact of extreme heat and maternal and child health because we saw there was a real gap in funding in that space. And to date, we know that the policymakers are listening, but it will be based on the research. The research will elevate that whole discussion about the impact of extreme heat on maternal and child health, and therefore we may get new policies. So really thinking about where is this research going, I think is a real priority, because then it will land the policy environment and then bring in the finance. I think the issue around the Green Climate Fund is to think about funding in stages. So smaller grants to get the team up and running, and middle-sized grants to really build out some strong results that can then influence change. And then think about if you have a grant that is maybe at the level of £2 to £3 to £4 million, what's the next stage? The next stage will be to say this has got to impact on the national agenda. The Green Climate Fund comes in at 25 million. Yeah. So you have to then say, well, what role could our research play in catalyzing new resources for the country that will actually translate some of the research into practice, build new research questions, etc. So I think having a bit of a political head, if you like, when thinking about your research is good. But then again, on the other hand, there is this thing about innovation and new areas that nobody else has thought of, but you have a gut feeling or some insights that you could build out on. And then you can get the more innovative funding streams to come and support you. So, and then align your interest with the type of funding that is coming through. So some research funding is really looking for innovation. It really wants to be like the first time somebody has mentioned this subject. This is a really new area. It may have implications, but we don't know yet. And other ones, it really is like, we know there's a policy opportunity here, and you're kind of really building out a narrative with your research and building the evidence space that will support funding. So being clear about that, I think, is going to be particularly important in Africa. At the end of the day, African governments are going to have to come in behind researchers to support things. And of course, they will do that for things that are critical to them and their own agendas. If you don't understand what those are, you're unlikely to get those resources. But like I said, when I started at Wellcome, we were spending maybe 10 to 15 million pounds on climate and health a year. We are now spending over 100 million. And we see other funders coming into this space. And we are, as Matthew said, coordinating with other funders and talking to IDRC and FDDO and others that are looking to build resources in this space. But at the end, it then comes into what are the multilateral funders doing, what are government funders doing. So alignment, coordination is really important, but also just having some really important research to do because somebody else hasn't done it, or they haven't done it in the context that will drive a policy change where you are. And yeah.
Thank you so very much.
That will bring in the longer term funding.
Yeah, thank you so much. I think that you're very clear in your submission, and some keywords have come out from what you've said is one, alignment. So if for me as a researcher, in aligning, you align to the funders' call in terms of their key requirements, but you also align in terms of generating prerequisite evidences that will inform decision based on the interest of policymakers, because these are likely going to attract some funding. So let's see how we can articulate all of this and be able to put our foot in the right places. But again, Madeleine did mention a lot around innovative researches, and especially being a new field, especially in this continent. I think there are many areas of innovation. And for example, how can we better use climate evidence and information to inform early warning system and greater health intelligence? So these are things that we can look at.
Absolutely.
And thank you so much, Madeleine, for bringing this to fore. So lastly, I'll turn it back to Oti as we wrap up this section. Just 1 minute, Oti. I'm going to ask you to summarize your thoughts, but highlighting specifically the importance of digital health innovation. What role do digital technologies play in advancing climate and health response? And how is IDRC supporting the development of these tools? I see a lot of young people here who are actually digital innovators. I think they will benefit from that information. In the next just 1 minute for time. Back to you,
Yes,
Sam.
Thank you, Charles. So I see myself as a techno-optimist. I'm a firm believer that technology has tremendous potential to sort of level the playing field on a number of issues. We saw that in Kenya, here where I'm based, how mobile money was absolutely transformational for fostering financial inclusion. And now we're at the cusp of the AI revolution. And there's so much potential that AI has. So we as IDRC, we are taking a big bet on artificial intelligence in global health. but we're particularly interested in advancing responsible AI innovations. So AI innovations that are ethical, that are legal, that are socially responsible, that respect human rights, and that are environmentally sustainable. And so similar to the climate change and health hubs, we've set up artificial intelligence for global health hubs across the regions where we work. And they're already beginning to develop some really amazing innovations for early detection, for surveillance, early warning systems, for even sentiment analysis, for example, to tackle misinformation and disinformation. So there's tremendous potential. We've not yet seen a lot of it moving towards that nexus of climate change and health just yet, but I think that potential is there. Climate data is very complex. Health data in itself is complex. And AI is built for complexity. So how can we leverage AI to bring those two data sets, sources, so to say, together and help us address some of the challenges that we face in this space? So I'll keep it at that. And thank you, Charles, for the opportunity.
Thank you, Sam, for those ideas. I think, colleagues, you've picked one or two things from what Sam has said. Let's continue to innovate, especially with the advent of AI. It's a very great tool. And then let's continue to build digital innovations that will bridge the gap at the nexus between climate change and health. Colleagues, you must bear with me. I think I've been speaking from the car all this while. I traveled to Kampala, and I was shuttling between Entebbe and Kampala, and I just got to the hotel. So if there has been any disruption, you bear with me with respect to my network. But I think so far it's been a very productive time. So we'll turn it over to our participants. Let's see your questions, and then our panelists will be able to take those.
Dr. Charles, are you able to access the Q&A document? Bear with us for 1 minute here. Dr. Charles, are you able to get into the Q&A document?
You should keep some music, kind of elevator, waiting room, telephone line music for these kind of situations.
Or maybe somebody could sing.
Yeah, in my younger years, I might have sung, but I think those days are past.
Oh, come on. No, you still got it. You still got it. Dr. Charles, I believe you're muted. We can't hear you.
No, so I'm trying to get access to the Q&A document, but then one of the things I can see is there's a question here. Are there any postdoc positions with regards to climate change and AMR, antimicrobial resistance? Any of the panelists? So let me start with Matthew. Any current postdoc position?
I mean, employment in this sector is growing. So if you are a researcher and you are interested in trying to think through where or what field of research you might have good opportunities in, then this is climate change and health is most definitely must be one of the fastest growing research fields. Maybe with AI. So if you're at the intersection of climate change and AI, you're guaranteed of a postdoc position. It's sadly not as simple as that, but there's a lot of adverts out, and you just have to prepare yourself and your CV, as you know, as much as you can, and get yourself out there, stand up for opportunities. And so there's none that I'm aware of. Our team is growing quite fast, so we welcome talent from anywhere across the continent. But yeah, there is so much happening in the space, and so many ways for you to enter.
Thank you very much. So get your CV, put together all your work, and then let's continue to look out. But I'll ask Sam, are there any postdoc opportunities?
Not specifically, but like I said, once the hubs are announced and they launch their calls, I mean, I encourage everyone to consider applying. And within these applications, as I said, our approach has been to encourage that the applicants building postdoc studentships, doctoral studentships, master studentships, etc., into those grants, provided the funding is sufficient for that. So that's what I'll encourage. But for now, nothing specific. At IDRC, however, we have what we call research award recipients. So it's an annual competition that we run. And it's within the different programs, one of the 5 program areas that we have. So that includes climate change, that includes global health. It's a competitive call. Sometimes it's based in our head office in Canada, and sometimes it's based in one of our regional offices. I hosted a research award recipient in our Nairobi office in the past year, and she worked on vaccine hesitancy in pastoral communities. So it's a 1-year fully paid position, and you get to do a research, but you should have completed your PhD or a master's when you apply.
Okay, Madeleine. So this one, I'll ask you this specifically. Beyond research funding, is there any form of funding for community-based intervention, awareness, and education with respect to climate change and health? That's one of the questions from the participants.
Yeah, so that's a really interesting question. At Wellcome, we are really lucky in that we have a whole research programming team which focuses on discovery research. And I would encourage people to look at the discovery research opportunities. They're topic agnostic, but you can put climate and health opportunities, projects are there. Then we have infectious disease, mental health, and climate and health. But in addition to that, we have departments that are focused on community engagement. And quite often this is aligned with our research activities, but some of them is really just about engaging society in understanding the relevance of science to their health. And recently in New York, we had a big event at the Natural History Museum on climate and health. We have invested in teams in Africa with youth, understanding how to communicate around climate and health and engage communities. So for us, it's always about engaging society and bringing science in its broadest sense, to those that need it most for solving particular health issues. But there is opportunity, absolutely, in the communication side of it. And in our Climate Impact Award, which we're developing our 3rd year, in that award in particular, it has explicitly called out the need for not only policy engagement, research, community engagement, but also a communication strategy that will bring the research to the policymakers and fully engaging with the community that the research is supposed to serve. So yes, the answer is, and I think other funders are also, where they have the opportunity, are looking at public engagement is critical to science uptake. And we've seen that in society. If the public doesn't like what the scientists are doing, they don't use the results. So it's really important to invest in that space.
Okay, thank you very much. I think those are well taken. I think there's one other, just part of information. Sam and Madeleine, could you share the links to the websites of your institution? So I think you can do that on the chat. Then, how can healthcare facilities benefit from climate change and health funding? Any available opportunities that we can tap or benefit from? So I'll turn it to Sam and then Madeleine.
Yeah,
Sam, the question is, how can healthcare... Okay.
No, at the risk of sounding like a broken record, again, I wanted to refer people to the opportunities to apply to our hubs. I think also one of the critical issues that we're looking at, and again, I mentioned it in the beginning, that there's climate funding that is available, whether it's adaptation funding, the green climate fund, etc. Yes, as Madeleine said, some of these funding sources are really large, and so if you're a small actor, it's quite complicated to to get access to them. But then there are some opportunities where there might be consortia that are coming together to try to access some of these funds. And so maybe a good strategy would be to be part of those consortia. Another thing that I've seen that is happening quite often is that some funders now are investing in vulnerability and adaptation assessments in various countries. And these assessments are aimed at informing health national adaptation plans. And some of these assessments involve health facilities. So I'll say on the whole, I mean, there is the opportunity for health facilities to get involved. I don't see a strong opportunity as a standalone health facility. And maybe Madeleine, you have a different opinion, but I think as part of a wider ecosystem or consortium approach, I think that is where you could find the sweet spot to unlock some of the funding that is available.
Oh, thank you so much. Yeah, thank you. And Madeleine, 1 minute.
Can you repeat the question, please?
So, Charles, sorry.
Can you
Madeleine,
repeat the question?
Oh, sorry.
Me or Madeleine? Me. Or both.
Yeah, I thought you wanted to make a comment.
Sorry.
Yeah, I did. So, Sam, that holds something that's a slightly different view to you on some of the points you raised. I think we should start off where what we think the end game is. So we're ending the talk. We end the conversation by thinking what's the end game. The end game is, in my view, a countrywide, facility-wide program that does climate change and health. Just like you have malaria pills in all facilities or sanitizer, whatever, you have a climate set of interventions in all facilities across the country. And to do that, you would have to have this international funding mechanisms, like the Green Climate Fund and others, and national funding. But it would need to be through this really strong international financing, like the Global Fund and PEPFAR, etc., were for HIV, and Gavi, etc. So I think working back from that is that as researchers, we either create the evidence, drive the projects like Madeleine spoke about, and get the Green Climate Fund up and running. Otherwise, we shall never reach the point at which we want this game to end.
Yeah, and then lastly, so I agree with you completely, and that is why we need to actually look also inwardly within the context of the member states, okay, the countries. How do we get funding for climate change related issues? And that brings me to the question from Actor, who asked, how feasible is it for African governments to leverage natural resource revenues or other sustainable financing options, such as green bonds, to fund research initiatives that are focused at the nexus between climate change and health? So for health workers that are here, what will you advise them in terms of advocacy toolkits that can help to promote government intervention in funding climate-related researches? So I'll take one comment from Madeleine, one from Sam, and one from Matthew as wrap-up. Yeah.
Sorry, that's very specific, but I think a critical thing that we haven't had in this conversation is actually identifying partnerships with the non-health community, because so much of climate change actually comes from outside of the sector. So looking at the way health is described in transport, energy, agriculture, etc., and using those toolkits, if you like, the way that they engage with climate change and adding a health lens to that, I think creates a new opportunity.
Okay, great. Okay, Sam?
Yeah, no, I agree with Madeleine, and I think that's the missing piece. And it's not just in climate and health, right? We always see that communities are usually the last to know, the last to be involved, and their voices are not typically represented. So how can we really work with the grassroots organizations to strengthen their capacity? I see some movement towards citizen science, participatory action research. In other domains, I'm not yet seeing it as much yet at this nexus of climate and health, but I think that is such an important aspect to begin to make that case and I think it will strengthen the ownership argument, right? If you have grassroots organizations, community organizations driving the agenda, advocating for domestic resources to move towards this sector. I think that will really strengthen the case. But having said that, we just need to be realistic. A lot of our governments, especially in the global south, they have so many competing priorities, right? I remember, and very quickly, anecdotally, this one minister of finance saying to me that everyone comes to me with an investment case. HIV people come, malaria people, all of you have great investment cases. Who should I go with? You're all right. You all have a case to make. And so we need to be realistic about what our governments can do. Yes, there are other issues like transparency, lack of transparency, whatnot, accountability. Those aside, there's illicit flows of financial flows and whatnot. But again, we still need this funding from external sources, at least for the foreseeable future. And how can we collectively make those arguments through the evidence that we generate to begin to attract those resources into this space?
Thank you so much. One last one from you, Matthew. Any last comments?
I can see Cecilia's looking over her shoulder, and I'll probably use more than my fair share of time.
Obviously. We just have 3 minutes to wrap up, actually. So I want to really thank you all panelists for a very great time out. I want to thank you for making out your time, sharing your knowledge, sharing the opportunities. We're very grateful. And on behalf of all of you and the participants, I want to say thank you. And for participants, I think it's been a very interesting moment. I do know that most times when you ask people, or especially health workers or researchers, what is your major problem, they'll say funding. But I've come to realize that funding is not usually the major problem. You need to have clear ideas. You need to know what you want to do. You need to articulate all of this first before you go to the funds. Because one thing I see most times when people say the only challenge is funding, it clouds their mind about all the other opportunities and innovations that can be available. And that was why intentionally in this course, we didn't bring financing at the onset. We brought it last. So by the time you can understand all the climate change issues and you begin to ideate on what you need to do to be able to mitigate their occurrences, then we can now start thinking of funding options, which is what our panelists have provided. So I want to thank you, Madeleine. I want to thank you, Sam. And I want to thank you, Matthew, for a very wonderful time. At Africa CDC, actually I'm in Uganda because we're trying to finalize a continental strategy on climate change and health. And I think some of those inputs that you've given me are rich content that I'm going to incorporate. But I want to say that we're going to have a continental agenda that helps us to articulate these issues better. And then, of course, the Africa CDC through the African Union provides a political platform where we can better advocate to heads of states and other key policymakers. So thank you, everyone, for this time out. I'm going to turn it over back to Cecilia. I'm just on time for him to be able to take the next segment, which has to do with partners' final words. Back to you, Cecilia. Thank you, panelists. Thank you, participants, for giving us your attention. Thank you.
Thank you.
Thanks,
Thank
everyone.
you so much.
Thank you, everyone.
Thank you to our panelists. Thank you to our moderator, Dr. Charles. Amazing. Always wonderful to have you moderating our sessions. We've come to the close of our course. It's been an amazing, amazing time over the past 11 weeks, hearing from experts across the continent and hearing from our participants, hearing from you, which is why we are here today. I'd like to take this time to give a huge thanks to our course planning team. We had a massive working group with representatives from WHO Africa, from Africa CDC, from the Chance Network, from Project ECHO, from the Global Network for Academic Public Health, and from the Association of Schools and Programs of Public Health in Africa. We also had representatives from IAMPFI, as well as the Africa Research and Impact Network, and the African Population and Health Research Center. So thank you all so much for all your contributions to this incredible course. I believe we have Patrick Uwili here, who is a program manager from the African Population and Health Research Center. Patrick, are you here with us to give some closing words?
Yeah, thank you so much, Cecilia. Can you be able to hear me?
Yes, loud and clear.
Yeah, thank you so much. Yes, to everyone, good morning, good afternoon, good evening, whichever region you are in. We actually do appreciate, and it is with immense pride and gratitude that I give this, a final remark on behalf of APHRC, the African Population and Health Research Center. As we mark the completion of the African Climate and Health Responders course, this program represents, a collective, effort to build the knowledge and skills needed to address, very urgent and complex challenges posed, by the climate change and public health related issues across our continent of Africa. To all the participants, you have shown, incredible dedication. You've shown passion. You've shown resilience, through this journey. Your commitment is really, really vital as we even continue to develop the different solutions that can be able to safeguard, health and well-being of our communities in Africa. I know that the knowledge and the network you have already created and gained over time since we started is very crucial to undertake, the responder kind of a strategy in our region. To our collaborators, thank you for the support and expertise and, in putting this thing together, which has been very instrumental towards success of the success of this program that has come to an end. Together, we are building a strong foundation for the future action on climate and health in Africa. As we move forward, let's continue to collaborate. Let's continue to innovate. Let's continue to inspire, and also create a healthier and a more resilient future for everyone in Africa, not only in Africa, but beyond the borders of or beyond the continent of Africa. Congratulations once again, and thank you all, and thanks again. Back to you, Cecilia. You are muted, Cecilia.
Thank you. I was just saying, congratulations to all the participants who have shown so much dedication to this course. We really appreciate you. And our work does not stop here. As I mentioned, there is an upcoming opportunity, a Train the Educator program, where we are going to be inviting those of you who completed the course to apply to be part of this small community of practice, which will be surrounded by an incredible expert network that will enable you to deliver climate and health responder courses to your communities. So please look out for emails from us. On behalf of the Global Consortium on Climate and Health Education, we invite you to join us as an individual, as an organization, and as an academic institution. We currently have nearly 400 health professional training institutions from around the world who are members of the consortium, who have pledged at the level of the dean or head of school to train their students in climate and health, and we really encourage you to join us. We will send you news as we sort of plan our next engagement for the larger community. Hopefully next fall, we will be planning another course. We will be sending you an email following this session where you will be able to complete the course evaluation as well as take your exam. So with that, thank you so much again, and we hope to see you all soon on a future GCCHE course. Take care.